Jeb Hensarling is a Republican from Texas. He is on the House Budget and Finance Services Committee. Hello, Congressman. How are you?
I'm doing well. Good morning. Thanks for having me.
This is a big number. I mean, we asked our brain room to do some research on the medical malpractice costs. This is the number they came up with: $30 billion in 2007 in med mal costs, including what we pay out to third parties, defensive costs, administrative expenses. It does not include the indirect costs associated with the general practice of defensive medicine in terms of extra tests and so on that these doctors order. President Obama has given this lip service, saying, and I want to get the quote right. Here it is. Hold on. He's sensitive to it, but he hasn't done anything about it. Is there any proposal you know of, Congressman, on Capitol Hill that deals with this right now?
Well, there are several, and I'm glad to hear the president's sensitive. We'll start with sensitivity. We hope that it follows up with action. I mean, listen, people want the health care they need when they need it at a price they can afford. One of the huge cost drivers is clearly the cost of frivolous lawsuits. We had a huge medical malpractice problem in Texas, frivolous lawsuits. 1 out of 4 doctors was getting sued in Texas 7 or 8 years ago. 85% of the suits were dismissed, but it was a huge cost. Doctors were leaving the states. Insurance companies were leaving the states. The state legislature passed a bill of comprehensive medical malpractice reform. Guess what? We went from 4 insurers to 30 insurers. The number of doctors in Texas has increased 30%. The cost of medical malpractice insurance has dropped by double digits. And so there's legislation now, I believe that Congressman Shadegg of Arizona and others have legislation that would cap these lawsuits, which are just adding so much cost to the system.
All right, but that is where the president's sensitivity ends, because he said he's sensitive to it, but he has come out and said, I stand against caps on jury awards in medical malpractice cases. Can you reform malpractice without trying to deal with caps on these astronomical awards, which I should point out for the viewers, the bulk of these huge awards goes to the lawyers, not to the plaintiffs.
Well, exactly. This has a lot more to do with making personal injury trial attorneys happy than it does getting struggling American families the health care they need when they need it at a price that they can afford. I'm disappointed in the president's stance. No, the answer is no. You cannot have any effective medical liability reform without capping these fees. It's just impossible. And you pointed out, I think in your own analysis, frankly, the figure of what we could save is much higher. I spent our congressional July 4th recess talking to a bunch of doctors in my district in Texas, in East Texas. I got to tell you, every single man and woman I met with who practiced medicine estimated that 15 to 30% of the medicine they practice is defensive medicine.
Oh,
They're
yeah.
ordering tests that they don't think need to be required, but it's a cost to the system because fear of lawsuit. If you don't cap those suits, you don't get the reform.
It's incredible how we demonize doctors. You know, the people who we turn to in the worst moments of our lives when we get terrible medical news, those are the ones who we put our lives in the hands of, and yet we demonize them, and it's very important to us to hold open the door to lawsuits against them. Meantime, this is what our doctors are dealing with. In states like Florida, some family doctors don't make a lot of dough. Most of these people make, if they make $100,000, it's a lot for them. Some pay more than $50,000 a year in med mal insurance. Some high-risk specialists, like surgeons, pay more than $200,000 a year. They are now saying that in the state of New York, a recent survey, 50% of the doctors said they were seriously considering leaving the state to practice elsewhere because of med mal costs. And the specter of litigation nationally, 49% of doctors surveyed said it is keeping us from performing certain medical procedures because we are so worried about the plaintiff's trial bar.
Well, the bottom line is I don't think anybody's serious about health care reform who isn't willing to cap these fees. Now, listen, I agree with you. There are bad doctors out there, but the answer is not frivolous lawsuits, and it's not these incredible liability and cost imposed upon all of us. It's take their license away. That's what you do with bad doctors.
How do you get to it, Congressman?
Let
me interrupt you because I just want to get an answer to this question, and we're running out of time. How do you get to it? How do you get to the point where you allow the legitimate plaintiffs who really were injured by bad doctors to get what they deserve without a cap? Because if they deserve $5 million, that's what they deserve, but still rein in these ridiculous costs and these ridiculous lawsuits.
Well, one, there has to be something punitive about people who file frivolous lawsuits, one after another after another. There has to be some cost associated with that. In addition, you know, you want to make sure that any economic loss somebody suffers, that they get the compensation. Another thing to do is to limit the fees that the trial attorneys take. At least let the money go to the patients. That would cut it back as well. But there's something fundamentally wrong in America when it's easier to sue a doctor than it is to see a doctor. And without capping these frivolous lawsuits, you're just not going to get there.
Did you say limit the fees the lawyers are going to? The horror! Good luck getting that passed on Capitol Hill with the plaintiff's trial bar so strong. But Congressman Jeb Hensarling, we appreciate your insights on it, and we'll be watching. You've heard it here, folks. You've got a Republican bill that's got some attempted reforms in it. But to my knowledge, none of these Democratic bills being debated have anything about reforming Med-Mal. Congressman, thanks.